What if I told you that your feet could be warning you about diabetes, months or even years before a blood test ever does? Most people believe diabetes is something you only discover in a lab. You go for a checkup, your blood sugar comes back high, and that's when you find out. But in reality, your body doesn't stay silent that long. It starts sending signals early, and one of the very first places those signals appear is your feet. The problem is, almost nobody recognizes them. People notice numbness and think, it's just age. They feel a burning sensation and assume, maybe I walk too much. They see dry skin or cracks and say, it's just the weather. And while those explanations sound harmless, in many cases, they're not. Because these small changes can actually be early signs that your blood sugar has been elevated for a long time. And the longer it goes unnoticed, the more damage it can quietly do to your nerves, your blood vessels, and your overall health. I've seen patients walk into clinics feeling completely fine, only to discover they've been living with diabetes for years without knowing it. No pain, no warning they recognized, just small signs they ignored, especially in their feet. In this video, Dr. Nathan Collaway will show you 9 warning signs in your feet that could indicate diabetes. For each one, you'll learn what most people think it is, what's actually happening inside your body, and one simple thing you can start doing today. Because the goal is not to scare you, it's to help you catch something early when it's still manageable. If you're over 50, or if you've noticed anything unusual in your feet lately, this is something you need to pay attention to. Because sometimes the smallest signs can be the most important ones your body is trying to show you. Let's start with the first warning sign, and this is something so common that most people ignore it completely. Numbness or tingling in the feet. Almost everyone has experienced this at some point in their life. You sit for too long, maybe with your legs crossed, or in an awkward position, and suddenly your foot feels asleep. There's that pins and needles sensation, maybe a little numbness, and then, after a few seconds, or a minute, it goes back to normal. That's completely normal. But here's the important question. What if it doesn't go away quickly? What if it keeps coming back, again and again? And what if it starts happening even when you're not sitting awkwardly? This is where you need to start paying attention. Because frequent numbness or tingling in the feet can be one of the earliest warning signs of nerve damage caused by high blood sugar. In medical terms, this is called peripheral neuropathy. Now don't worry about the term. Let me explain it in a very simple way. Your body has a network of nerves that act like communication wires. These nerves carry signals from your brain to your body and back again. They tell your muscles when to move. They tell your brain what you're feeling: heat, cold, pain, pressure. But just like electrical wires, your nerves have a protective coating around them. This coating allows signals to travel smoothly and clearly. Now imagine what happens if that coating starts to wear away. The signal becomes weak or distorted. Instead of a clear message, your brain receives a confused one. That confusion is what you feel as tingling. That distortion is what you feel as numbness. And here's where diabetes comes in. When your blood sugar stays elevated over time, it begins to slowly damage that protective layer around your nerves. Not all at once, slowly, quietly, over time. That's what makes it dangerous. Because you don't feel the damage happening. You only feel the result, weeks, months, or even years later. Now let me give you a simple example. Think of your nerves like electrical cables running from your brain all the way down to your feet. Your feet are the farthest point in that system. So if there's any damage along the way, the feet are usually the first place where problems show up. That's why tingling and numbness almost always start in the feet first. Now here's something very important that most people don't realize. This process often begins before diabetes is even diagnosed. In fact, many people live with elevated blood sugar for years without knowing it. During that time, the damage is already happening, quietly, and the only signs they may notice are small changes in their feet. Now let's talk about what most people do when they feel this. They ignore it. They say things like, "It's just my foot falling asleep. Maybe I was sitting wrong. It happens sometimes, nothing serious." And once in a while, that may be true. But if this sensation is happening regularly, your body is trying to tell you something. Another pattern many people notice is that this tingling becomes more noticeable at night. When you're lying in bed, there are no distractions, no noise, no movement. You're more aware of what your body is feeling, and that's when the tingling or numbness can feel stronger or more uncomfortable. Some people even describe it as a buzzing or crawling sensation under the skin. That's not your imagination. That's your nerves sending unclear signals. Now here's why this matters. Because nerve damage doesn't just cause discomfort. If it continues over time, it can reduce your ability to feel things properly, and that can become dangerous. For example, you might not feel a small cut or blister on your foot. You might not notice irritation from your shoes. You might not realize there's a problem until it becomes more serious. And this is exactly how complications begin. Small problems go unnoticed and then grow. Now the good news is this. At this early stage, there are things you can do. Simple things. Effective things. One of the best things you can start with is daily movement. Even a 20 to 30-minute walk can help improve blood flow to your feet. And that blood flow is essential for keeping your nerves healthy. Because nerves depend on oxygen and nutrients carried through your bloodstream, when circulation improves, nerve health improves. Another important step is becoming more aware of your sugar intake. You don't need to completely change your life overnight, but reducing added sugars, soft drinks, processed snacks, excessive sweets can help stabilize your blood sugar levels, and that directly reduces stress on your nerves. Now let me ask you something. Have you noticed this in your own feet? That slight tingling? That numbness? That falling asleep feeling that comes back more often than it should? If the answer is yes, don't ignore it, because this could be one of the earliest warning signs your body is giving you, and catching it early can help you prevent much bigger problems later. In the next part, we're going to talk about another sign that many people experience, especially at night, and often find even more uncomfortable. A burning sensation in the feet that feels like heat coming from inside the body. And once you understand what causes it, you'll never look at it the same way again. Now let's move to the second warning sign. And for many people, this one feels even more uncomfortable and more confusing. A burning sensation in the feet. Some people describe it as heat. Others say it feels like their feet are on fire, even when the room is cool. And what makes it even stranger is this. It often gets worse at night. You lie down, trying to relax, and suddenly your feet feel hot, irritated, or restless. You might move them around, rub them, or even take them out from under the blanket, but the sensation doesn't fully go away. Now here's what most people think. They assume it's fatigue, poor circulation, or just a long day on their feet. And sometimes that may be true. But when this burning sensation becomes frequent, it can be a sign of nerve damage caused by high blood sugar. This is closely related to what we discussed in the first sign, but instead of numbness or tingling, the nerves start sending overactive signals. Let me explain. Healthy nerves send clear, controlled messages to your brain. They tell you when something is hot, cold, or painful. But when those nerves are damaged, they can start misfiring. It's like a faulty electrical system. Signals are sent when they shouldn't be, or they're stronger than they should be. And your brain interprets that as burning heat or discomfort, even when there's no actual heat present. That's why this sensation can feel so real and so frustrating. Now let's talk about timing. Why does it often get worse at night? There are a few reasons. First, when you're resting, your body becomes more aware of internal sensations. There are fewer distractions, so things that you might ignore during the day become more noticeable at night. Second, circulation patterns change when you lie down. Blood flow redistributes, and this can sometimes make nerve-related sensations more noticeable. And third, your nervous system becomes more sensitive in quiet environments. So even small signals can feel stronger. Now here's something important to understand. This burning sensation is not just about discomfort. It's a signal. It means your nerves are under stress, and if that stress continues over time, the damage can progress. What starts as occasional burning can turn into constant discomfort, increased sensitivity, or even loss of normal sensation. Now let's talk about what you can do. Again, the goal is not to panic. The goal is to respond early. One of the most effective steps is improving blood circulation, because nerves rely on good blood flow to stay healthy. Simple daily movement, like walking, helps deliver oxygen and nutrients to the nerves. Even light stretching or gentle leg movements can support circulation. Another helpful step is paying attention to your foot care routine. Keep your feet clean and dry. Use a gentle moisturizer if your skin feels irritated, but avoid heavy creams between the toes. And most importantly, check your feet regularly. Look for any redness, irritation, or changes in the skin. Because when nerves are affected, your ability to feel problems can decrease. Now let's talk about temperature. Some people try to relieve burning feet by exposing them to very cold surfaces. But extreme temperatures, especially cold, can sometimes make things worse. Instead, aim for a comfortable, moderate temperature. Now here's a question you should ask yourself. Have your feet ever felt unusually warm, especially at night? Have you felt a burning sensation that didn't match the actual temperature? If the answer is yes, and it's happening regularly, don't ignore it, because this could be another early signal that your body is trying to give you. And just like the first sign, catching it early gives you a much better chance to manage it. In the next part, we're going to talk about a warning sign that many people overlook completely, but it's one of the most important ones. Small wounds or cuts on the feet that take longer than usual to heal. And once you understand why this happens, you'll realize why it's something you should never ignore. Now let's talk about the third warning sign, and this one is extremely important. Small cuts, wounds, or sores on the feet that take longer than usual to heal. At first, this may not seem like a big deal. You get a small cut, maybe from walking barefoot, a shoe rubbing against your skin, or trimming your nails. Normally, your body takes care of it. Within a few days, it starts to heal. Within a week or two, it's gone. That's how a healthy body works. But here's where things change. What if that small cut stays there for weeks? What if it doesn't fully heal? Or worse, what if it slowly gets bigger? This is where you need to take it seriously, because slow healing wounds can be a strong warning sign of poor blood circulation and elevated blood sugar levels, both closely linked to diabetes. Let me explain what's happening inside your body. When you get a cut or injury, your body immediately starts a healing process. Blood flows to that area, bringing oxygen, nutrients, and special cells that repair damaged tissue. But when blood sugar is consistently high, two major problems begin to develop. First, blood vessels become damaged. High sugar levels can weaken and narrow the small blood vessels that carry blood to your skin and tissues. As a result, less oxygen and fewer nutrients reach the injured area. And without proper blood flow, healing slows down. Second, your immune response becomes weaker. Your body relies on white blood cells to fight bacteria and prevent infection. But high blood sugar can reduce their effectiveness. So not only does healing slow down, the risk of infection increases. Now combine these two problems. Reduced blood flow, weakened immune defense, and what you get is a wound that struggles to heal. Now here's what makes this even more dangerous. In many cases, people don't even notice the wound right away. Why? Because of what we discussed earlier, nerve damage. If your feet have reduced sensation, you may not feel a small cut, a blister, or irritation from your shoes. So the injury goes unnoticed. Days pass, then weeks, and by the time you finally see it, it may already be more serious. This is how complications begin. A small, harmless cut can slowly turn into something much bigger. And in severe cases, untreated wounds can lead to serious infections. That's why doctors emphasize foot care so strongly for people at risk of diabetes. Now let's talk about what most people do. They ignore it. They say, it's just a small cut. It'll heal on its own. No need to worry. And again, sometimes that's true. But if a wound is not improving within a reasonable time, your body may be struggling to heal it. And that's a sign worth paying attention to. Now, here's what you can do. First, and this is simple but powerful, check your feet daily. Take a few seconds each day to look at the bottom of your feet, between your toes, and around your heels. You're not looking for anything complicated. Just notice cuts, redness, swelling, blisters, or areas that look unusual. This small habit can help you catch problems early. Second, keep your feet clean and dry. Wash them gently, dry them carefully, especially between the toes, and avoid leaving moisture trapped, as it can lead to skin issues. Third, choose proper footwear. Shoes that fit well and don't rub against your skin can prevent many small injuries before they even happen. Now, here's another important point. If you notice a wound that doesn't improve, looks unusual, or shows signs of infection, don't wait. Getting it checked early can prevent much bigger problems later. Now, let me ask you something. Have you ever had a cut on your foot that took longer than expected to heal? Did you ignore it at first, thinking it was nothing? If so, you're not alone. Many people do the same. But now you understand why this matters. Because your body is not just dealing with the surface of the wound. It's dealing with what's happening underneath: blood flow, nerve function, and overall health. And when those systems are affected, healing becomes slower. So this is not just about a cut. It's about what that cut is telling you. In the next part, we're going to talk about another sign that many people overlook completely: changes in the color of the skin on your feet. And what those changes can reveal about your circulation and blood sugar levels might surprise you. Now let's talk about another warning sign that many people notice but rarely take seriously: changes in the color of the skin on your feet. At first, this might seem harmless. Maybe your feet look slightly darker than usual, or a little reddish, or even slightly bluish in certain areas. Some people think, it's just poor circulation. Maybe it's the weather. My skin just looks like this sometimes. And in some cases, that may be true. But when these color changes become consistent or unusual, they can be a sign of something deeper. Let me explain. Your skin color is directly linked to blood flow. Healthy circulation brings oxygen-rich blood to your tissues, giving your skin a normal, even tone. But when circulation is affected, your skin begins to change. Now, in people with diabetes, or those developing it, two major issues can affect the feet: reduced blood flow, damage to small blood vessels. When blood flow slows down, less oxygen reaches the tissues, and that can cause the skin to appear pale, bluish, or slightly purple. This is your body's way of showing that oxygen delivery is not as strong as it should be. On the other hand, if there's inflammation or pressure in certain areas, the skin may appear red, dark, or uneven in tone. Now here's something very important. These changes don't always happen suddenly. They can develop gradually. You might not notice them day to day, but over time, the difference becomes more visible. And because it happens slowly, most people ignore it. They assume it's normal. But your body is giving you a signal. Now let's connect this to what we discussed earlier. If circulation is reduced, wounds heal slower, nerves don't get enough oxygen, tissues become more vulnerable. So skin color changes are not just cosmetic. They reflect what's happening beneath the surface. Now here's another important point. Color changes often appear in specific areas: toes, heels, sides of the feet, around pressure points. These are areas where circulation is already more delicate, so when something starts to go wrong, these areas show it first. Now let's talk about what you should look for. You don't need to overanalyze, just pay attention to areas that look darker than the surrounding skin, patches that appear red or irritated, skin that looks unusually pale or bluish, uneven tone that wasn't there before. If you notice these changes, and especially if they stay for a long time, it's worth paying attention. Now, what can you do? First, just like we mentioned earlier, check your feet regularly. Make it a simple habit. It takes less than a minute, but it helps you notice changes early. Second, support your circulation. This includes gentle daily movement, avoiding long periods of sitting, keeping your legs active. Even small movements can help keep blood flowing. Third, take care of your skin. Keep it clean, moisturized, but not overly damp, and protected. Because healthy skin acts as a barrier, and when circulation is already affected, protecting that barrier becomes even more important. Now let me ask you something. Have you ever noticed a change in the color of your feet? Maybe a darker patch, or a reddish tone that didn't go away? If so, don't ignore it. Because your skin is often one of the first places your body shows signs of internal changes. And understanding those signs early gives you a chance to act early. Your feet can reveal early warning signs of diabetes, long before many people realize something is wrong. We talked about numbness and tingling. burning sensations, slow healing wounds, changes in skin color. Each of these signs may seem small on their own, but together, they can tell a much bigger story about your health. If you notice even one of these signs happening regularly, don't ignore it, because early awareness can make a real difference. If this video helped you understand your body better, consider subscribing for more simple, clear health information designed especially for adults over 50. And if you've experienced any of these signs, let me know in the comments. Sometimes, sharing your experience can help someone else recognize their own. I'll see you in the next video.